2023 was the year where AI broke out and everyone was talking about ChatGPT and all this. But it was there before, long before. And in healthcare, we see AI doing a few, maybe I'll list a few things that AI has been able to do in healthcare.
Okay.
First, by looking at the challenges that we have in the healthcare system. The first challenge we face in healthcare system, not just in Kenya, but across the developing world, number one is low resource settings. That means there's scarcity of equipment, there's scarcity of personnel. So we are working with very little resources, right? And that means there's fatigue. The few staff that are there, the nurses, they are working several day shifts, night shifts, and that leads to burnout, exhaustion, and things like that.
Yes.
The second thing is that the super specialized skills like oncology to do with cancer,
right,
or radiologists,
yes,
or pathologists.
Yes.
We realize that we only have like maybe 100 pathologists in Kenya.
In Kenya,
entire
yes.
Kenya.
It's
100 radiologists in Kenya.
Right.
So
against a huge population.
It's a huge population. So you can divide by the population, you see how many people is one radiologist serving in Kenya. So now here's where AI comes in. While human beings, we get fatigued by working so long, the AI is a vice versa of that. The more AI works, the better it gets.
The more effective it is. Okay.
Because AI works with data, right? So we found that, for example, in the area of early diagnosis and screening of diseases, whether you're using images like X-ray images or any other kind of images, AI can be able to do through what we call pattern recognition.
Okay.
By reading several images, you can start seeing what is a pattern for, let's say, every other cancer diagnosis. What is a pattern in the image, in the X-ray scan, right? So over time, it maps that so well that every time you put an image, you load the image, it can be able to quickly rule out whether this is cancer or no cancer. So it helps now zoom in quickly, and then the radiologist can now focus on just looking at the cases that AI has already highlighted,
right,
to say, okay, now this one clearly is a positive case and we need to do now further tests. Remember, AI cannot replace the doctor or the clinician. The doctor or the radiologist has to sign off the report, right? You can't go with a report and say this was AI generated report.
And then that's just about it,
So the doctor now will be able to come in and sign it off.
Okay.
So you can see that how now that can reduce the workload.
The workload, yes. And the hours even spent.
The hours spent.
Yes.
And remove errors. You know, human beings, we are prone to error. So you find that it becomes more effective, and it's a win-win. Brings down the cost low, and that's good for everyone.
Right.
The other thing that AI can do, which is very interesting, is in the area we call precision medicine. So factoring in your genetic composition, your lifestyle habits, if there's any diseases in your family, if your work lifestyle, if you feed all these things, AI is then able to help us give a treatment that speaks specifically to you.
Oh wow!
Not the general treatment that will be given to any other person, but something customized for you. Because your body is so unique. The same way we have unique fingerprints, your body is so much different from any other person. So we find that if we go now into precision medicine, we are able to know what is a treatment regimen that will work best for you. Right. Yeah. So this is another area where AI can come to help in. We also have something called Gen AI, generative AI, which can also help with generating reports. Again, in the medical world, there's a lot of reports.
There is a lot of paperwork as well. Yes.
So you can imagine if the AI takes the first stab of that, and you are a doctor, you've had a busy day.
Yes.
And the AI is just giving you these summaries that you can just edit a little bit and be able to submit the